Welcome back to Fox 2 News in the morning. Well, statistics have proven there are disparities when it comes to health care for minorities. Those can go from structural racism, access to care, to maternal issues. Dr. Amber Johnson, Executive Director of the Institute for Healing, Justice, and Equity at SLU University, joins us now live to talk about Critical Futures, a new podcast meant to educate and give some insight on how to change these issues for the future. Good morning to you.
Good morning.
So first off, let's talk about these disparities.
Sure.
This is something that we've been talking about for a while now. Studies are coming out, and we're kind of seeing the differences in healthcare and how that affects minorities. Tell us a little bit about that.
Sure. So one of the important things is to think about systems versus structures, right? And so racism as a system is impacting lots of different structures that then impact your actual lived experience. And so these structures could be health insurance, right? Private versus public. These structures might look like interpersonal relationships with a patient and a provider and how we talk with each other. And all of these things then work together to create a system that then impacts outcomes unevenly, right? So it's inequitable. So we have someone like Faber Jubilani, who is the Executive Director of Ford through Ferguson, going through childbirth and almost dying despite having health insurance, despite having a two-income household, despite having multiple degrees. She's still subjected to the same structures.
Okay, so we've identified these issues, and you guys are discussing ways to address them and how to come up with some solutions on this podcast. So tell me a little about who the podcast is in partnership with and how it all came together.
Sure. So the Institute for Healing, Justice, and Equity is a group of 4 professors who came together and said, we have all this research around all these issues. What are we going to do, right? So one of the things is we have to help people heal from these things. Another thing is we have to create equity. We have to change systems. And so the podcast was really about taking these ideas and making them accessible to lay folks. The average, common, everyday person can tap in, listen, and learn about these things and how they impact them, and then maybe even get involved. And so with support from the Robert Wood Johnson Foundation, we launched Series 1, which is all about anti-racist healthcare policies and healthcare in general, and how we create health equity.
Okay, so how can we listen to the podcast? I'm thinking it's educational. What are some of the other topics that you guys will be hitting for those people interested in tuning in?
Absolutely. So Series 1, again, is about health equity and healthcare policy. Series 2, though, is called the Future of ... where we talk about experts from a variety of sectors. So mental health, art, activism and organizing, prison abolition. And we're just talking about what does the future look like and how do we get there. Our podcast is available on every single podcast streaming source from Spotify and Apple to Google. It's super accessible, and I hope people do tune in and think about ways to create their own alternative futures.
And I love the way you said that you all are speaking in simple terms. Sometimes you can hear medical terms and jargon, and it might go over your head and you're not understanding what's happening. Anybody can understand.
Anybody can understand.
Okay, thank you so much for joining us.
Thank you so much, Blair.
One more time, how can we listen in on the podcast?
So if you go to Spotify, Google, Apple, you can just type in Critical Futures and we should pop up at the top.
All right, thank you so much for joining us. If you would like to hear that information again, you can visit our website. We'll have this interview posted for you soon. That is fox2now.com.